So this year's, the actually inaugural gold medal award from the World Molecular Imaging Society goes, do I have a drum roll? Dr. Michael Phelps. However, unfortunately, Dr. Phelps was unable to join us today, and I will call his son, Patrick Phelps, to receive this award on his father's behalf. Two hands.
Great. Thank you.
Thank you. Want to say a couple words?
So I'm really proud to accept this award on behalf of my father. Unfortunately, he couldn't be here, but I promise you the story is exciting. We were chasing king salmon up in Alaska, and he injured his back on a 43-pound king salmon. So regret that he couldn't be here, but I appreciate the award. Thank you.
At least it was worth it, huh? So I would like to call Sam Gambier to the podium. Sam will share with us some important historic and biographical moments from Dr. Phelps' life.
Thanks, Yuri.
Thank you. Thank you so much, Yuri. It's a pleasure to be here. Good evening, everyone. Mike, in fact, luckily was not injured more seriously, but was injured enough to be in the hospital with complications of infection in his spine. But he is improving dramatically and now back home. So we wish him really the best of health going forward. What I thought I'd do is kind of tell you a little bit about Mike and his early life, what shaped him really, to kind of go into the psyche, if you will, of an individual, which is pretty tough, and I may be totally wrong, and Mike can comment in future years, but I've taken slides that Mike was going to present and additional ones that I thought helped me kind of understand a little bit about what has shaped Mike to do some of the things that he's done, which are in fact phenomenal. And so I hope this will be an interesting story for you as we go inside the thinking of a scientist. First of all, which Mike are we talking about? This is not a Photoshop. This is actually Mike Phelps meeting Mike Phelps. Actually, prior to this recent set of Olympics, they both occasionally touch base with each other. When I mentioned to my son the name Michael Phelps, he, of course, immediately, as a 12-year-old, thinks of the swimmer Michael Phelps. If you Google up Michael Phelps, our friend and colleague, the scientist, unfortunately, now gets trumped by Michael Phelps, the Olympian, who I think is at 22 medals. But they both have contributed, as you will see, in phenomenal ways, and really are an inspiration to all of us in terms of the things we do in each of our daily lives in scientific research. Mike's really had I would say, a very unusual career to science. I never fully appreciated this while I was a student at UCLA, and while I joined the faculty, I understood elements of this, but I never fully appreciated it. It's only after I left UCLA about a decade ago and have been at Stanford that the pieces have become clarified in my own mind. Mike started out as an amateur boxer for reasons you'll see in a minute, and unfortunately had further trauma, including head injury after a car accident. But luckily, neither of those two slowed down his brain much. He went on to get a BS degree in both math and chemistry in Washington State, not WashU, where he would do his PhD in chemistry. And then he was a faculty at WashU, working with actually both Mike Welch, who we heard about, and Ed Coleman. And I'll try to come back to both of them in a little bit. He left WashU for a brief time to go to the University of Pennsylvania, and then came to UCLA a little bit in the late 70s as a full professor. He had a very unusual passion for not only making sure that his research fostered, but that also things could make their impact on the global health population. He, in fact, did a lot to build the field of molecular imaging with the founding of CTI Molecular Imaging, which was really a unique event for a faculty member to take on, building such a company and such a company of such a significant magnitude to deliver PET to many people. This has since been acquired, of course, by Siemens, and PET continues to thrive and is perhaps one of the poster childs of what it takes to have molecular imaging be successful. But I want you to keep this path in your minds, because it is, in fact, a rather unusual path. I never fully understood, why Mike would treat everything like a boxing ring match, whether it be arguments with a dean, whether it be about a new grant. Everything was like a ring fight to Mike. And it still is in many ways, because he always relates things back to his boxing days and a key person in his life who had a huge impact on him. I also never fully understood his passion at the time I was a student at UCLA, but by the time I became a faculty, I began to appreciate just how driven he was and passionate he was about wanting to make a difference. And we'll come back to that as well. He has accomplished, I think, so much in the field that when you read CVs of people, and they're older, you always have the large number of published publications, but in this case, in Mike's case, about 720. He's had a phenomenal success with grants, with over 300 million in grants, and also with private fundraising. He was very good at raising gift money in the Los Angeles area, and I'll tell you how that was shaped and how that helped build what was possible in the field of PET. He's received many international honors and awards, the George von Hevesy Prize, not just once, but twice. That's from the von Hevesy Foundation. The Weir Mitchell Award from the Academy of Neurology, because as you will see of his groundbreaking contributions in the neurosciences and neurology with his first publication on the cover of Science back in 1981. He chaired the Nobel Symposium in 1983, the Paul Ebersol Award, the Ernst Lawrence Award from the DOE, the Enrico Fermi Presidential Award, which is, of course, very high honor in the United States, in this case awarded to him by President Clinton in 1998, the Kettering Prize by GM Cancer Research Foundation, the Case and Memorial Prize, the Leibniz Award, the Mastery Award, and he also gave a keynote address at the 2007 Nobel Symposium in Stockholm. He's a member of both the IOM and the National Academy of Sciences, very rare in the field of science. And he's still active in the chairman of the board role for the Norton Simon Foundation, which I'll talk a little bit about. And as I mentioned, he founded CTI Molecular Imaging, was one of the three founders of that company, which made PET possible and stuck with PET when many, including the large players in imaging, abandoned PET in the early years. So he's had a huge amount of intellectual contribution, but really you'd never know from reading anyone's CV what is really behind all these things and what drives all these things. So I started to ask Mike for some very early pictures. He did not know his father well. His dad and him are shown on the picture on your left when Mike is about 2 years old. His mom, who was very, very much a motivation, an inspirational source to him is shown here with Mike at the age of 3. And then his grandfather with him when he's about 5 here in Washington State, where he grew up. Up to about this point, he's actually leading a relatively normal life and growing up in that part of the country, probably not that different from most kids. But then major things start to happen in his life that turn his whole world upside down. His 2 brothers are burnt to death when their home is burnt to the ground. His mother is burnt over half of her body trying to save his brothers. And this whole process uproots Mike from his family significantly. And his neighbor, Ira Goldberg, becomes his boxing coach, his teacher and surrogate father for the next 11 years. Mike in this picture is on the far right with his mother and the 2 brothers he lost who burnt to death. This very early trauma, I think, shaped him in many different ways. But Mike always cites as a source of inspiration Ira Goldberg, his boxing coach, who really acted as his father for a long time. Here's Mike with one of his 4 sisters. He didn't just have the 2 other brothers who passed away, unfortunately, but actually also sisters. And now Mike is about 16 years of age, looking like a young Patrick Phelps, I must say, and very active at this stage in boxing. In fact, Ira Goldberg, his surrogate father, shaped Mike in very powerful ways. More than almost anyone I've ever met, Mike has this very ring-like battle approach to everything, as I mentioned. He views many things as a fight, and a fight that you have to step into, be mentally, physically, and emotionally prepared to win. And he often, as he mentors junior people, including myself, tries to get them to think in this way, because that's what shaped his own experience as he grew up. I never fully related to this. I'm scared just watching boxing, let alone thinking that I'm going into a ring with someone boxing. But I always appreciated that it was all about a battle. It was all about being psychologically ready. And even for that grant that you're getting ready for and spending that last month fine-tuning over and over and over, I learned a lot from how Mike thought through and took on each battle. There's a lot of controversy around the development of the PET scanner. Probably this is not the best forum to go into that. I have, for the Nobel Committee, often written, as several of you in the room have, about the events that likely transpired. The key is that Mike was seminally involved in development of a tomographic ring-based PET system. Brownell and colleagues at Harvard had looked at coincidence detection with 2 detectors. But when it came to starting to put a ring together to do phantom studies back in '73, it was Mike and Mike's postdoc at that time, Ed Hoffman, that took the lead to do so. I don't think in their wildest dreams they would have imagined that this device would have as big a global impact as it does now. Gamma camera imaging in nuclear medicine was common. Single photon emission computed tomography had not yet come about, but was being worked on by others at the University of Pennsylvania, as well as several groups around the world. WashU was a mecca, as it is even today, for biomedical imaging. So it must have been a phenomenal environment for Mike to grow up in and actually become a faculty in. The first system was not named the PET camera. It was actually called PETT. And that's because it was abbreviating positron emission transaxial tomography. Later on, it was one T that was dropped to form the name PET scanner. What you're seeing is an evolution to a clinical system, and actually the image on the bottom left is the first commercial PET scanner that came into existence back in around 1976. I remember being in that same room, although many years later, sleeping on that gantry of the PET camera. I always tell grad students in my lab, we worked much harder then. We actually slept in the lab, and I actually used to sleep on that gantry, on that camera, and I still remember it. And the Digital Equipment Corporation computers, the DEC computers and VAX computers that ran these systems have long since gone. I did not know Mike through this period. I myself came to UCLA in 1983 as an MD PhD student, but appreciate the rich history of what was going on at Wash U that eventually brought Mike to UCLA. This image changed many, many things. This was the cover of Science back in 1981. John Mazziota, who's now the chair of neurology at UCLA and a good friend of both Mike and myself, was learning how to apply PET for looking inside the brain. Imagine the excitement that Mike and John Mazziota and others must have felt looking at, for the first time, the activity with, in this case, fluorodeoxyglucose of what is going on in the brain with different tasks that an individual does. Right now, this would not be a big deal. We think about it as well, we know what areas are responsible for listening, for looking, for thinking, for remembering, and even for working. But this was the first look into a human brain non-invasively to do just that, and provided a full spatial map of glucose utilization, which is, of course, linked to then cerebral blood perfusion. It took a decade for this to eventually be supplanted by functional MRI, but it set the groundwork and stage for everything that would follow. I saw some of this, and I saw what it started to do to the neuroscience community. For example, pediatric neurologists like Harry Chagani, now in Michigan, were there at the time and started to apply these techniques for looking at the developing human brain and looking at what one does with seizures, including intractable seizures and entire hemispherectomies of patients that were considered taboo at the time. It fundamentally changed our ability to look in the brain. And work at Wash U by Marcus Reichley and colleagues, others around the country, was going on that led PET to become this powerhouse for neuroscience. If you haven't had a chance, go back to this original article. It's an inspiration for where some of the things we all work on now may be decades from now. And I think this is really, really a landmark piece of work. Also go and look at the work that followed by John Mazziota and brain mapping in general, and by Harry Chagani, and looking at pediatric brain development. Fascinating work. John Mazziota and Mike Phelps are now good friends. They had their difficulties over the years, but they have great respect for each other. They built this field of brain mapping by developing a whole brain mapping center. They did something, again, very unusual. They not only helped develop these technologies, they went to the NIH, in this case, to help open through the NINDS, multiple neuroscience PET centers. These neuroscience PET centers, 6 of which I think were originally funded, went on to change the field of neuroscience imaging. And now, if you go to UCLA, you will see a whole brain mapping center run by, for example, John Mazziota and Arthur Toga, as you will centers around the world that tackle all aspects of brain imaging, including brain mapping. Although Ira Goldberg was a huge impact on Mike and his development, being his boxing coach, being his surrogate father for well over a decade. The second man that would go on to shape Mike Phelps is Norton Simon. Norton, an industrialist in Los Angeles, worth in today's dollars several billion, happened to contact Mike after Norton's stepdaughter committed suicide, and then also Norton's son committed suicide. I think Norton had read a little bit about Mike and his work on the brain, and the two met, and Norton would become the second huge impact on Mike's life. He opened up channels for him with the U.S. Congress, opened up channels in fundraising that no one else could have done in a way that Norton did. The painting you see behind Norton is a Rembrandt painting, sometimes known as Titus, thought to be Rembrandt's son, but probably is not his son. If you ever go to Los Angeles, visit the Norton Simon Museum. Many of you might have visited the Getty Museum, but the Norton Simon Museum is perhaps even a greater treasure in Los Angeles, which houses many of the world's greatest arts. Norton's collection of those arts are in excess of $3 billion, although he's, of course, now passed away. This is Mike with his two kids, Katie and Patrick, who you just saw, and Norton Simon. Mike's wife, Patty, who I've also known for many years, is a phenomenal person. She's a neuroscientist at UCLA, and they have the two kids that you're seeing here. Now, Mike realized very early on that it wasn't just about the equipment, developing and improving the PET technology, helping to commercialize it, but that what would fuel this field would be not only the type of tracer, like FDG, but how it could be easily made and accessible. It's actually really the Achilles heel of our whole field, isn't it? You have to have a great tracer, great molecular imaging probe for a given biological problem. How do you get such a probe and how do you deliver it, especially for radiolabeled probes where the half-life of the isotope can be relatively short? How do you get that probe distributed, in this case, worldwide? The single photon community with technetium and other isotopes had solved this by generators, by having commercial distributors with longer half-lived isotopes. But for fluorine-18 or C11 positron emitters with a relatively short half-life, it was a whole different story. Mike always had this fascination, and still does, by making things easy. He would often think about PET as a game, and how do you play the game of PET? How do you do automated synthesis? How do you control things with just a simple button instead of a complex set of chemistries? He was always fascinated because myself and Dr. Osman Ratib, who's chair of radiology in Geneva, were the only two Macintosh users at UCLA in those days, and both Osman and I were fascinated by the Mac and how it made things easy. And yet everything that controlled PET instrumentation, cyclotrons, was this monstrosity of computers that were not easy to use. Mike always wanted new generation of technologies to become easier and easier to use, even to this day. He spent a lot of time trying to convince the world that cyclotrons need to be much simpler. And if it wasn't for a cyclotron company going broke and Norton Simon stepping in to help buy it, I think he would never have been able to make this leap. In fact, Cyclotron Corp was one of the ways in which Mike moved towards having these easy-to-use, self-shielded cyclotrons that would be controlled by a simple PC. And that vision and dream has continued into a next generation of technology we'll come to in a minute. This relentlessness on not just the instrumentation, but making the instrumentation available clinically and worldwide was met with a lot of skepticism. Frankly, no one believed, even in the nuclear medicine community, that PET would ever be anything more than a research tool. How are you going to distribute these tracers, and how will you make it so easy for clinicians to use these tracers, including FDG? But Mike knew that for PET to succeed, the tracer part of the equation would also have to succeed. PET radiopharmacies became this vision. Shielded miniature cyclotrons, PC controlled as I mentioned, then started to distribute throughout the country and then eventually throughout the world. PETNet, as it was called, was the key to this, and PETNet actually gave birth to making this on a national scale also a profitable venture. Now PETNet is, of course, run by Siemens. Mike, as a PhD and not an MD, had a very significant clinical mission, more than I've ever seen in any basic or translational scientist. Not having worked clinically, he was always obsessed with what physicians do to make decisions and was always thinking about PET as a clinical tool. Instead of doing what I think most people would have done, which is focused on yet another paper to show another cool piece of maybe neuroscience, he made it his mission and relentlessly spent years and years convincing others, even though everyone kept saying no. In fact, independent of the invention of PET, I think there's one other area that the whole community owes a great tribute to, and that is his personal drive to do this, because it really did take a huge amount of effort. That led to a huge dissemination of clinical PET centers, which are, of course, now common throughout the world. I remember the first time a whole-body oncology image from a PET scanner was being produced by Phelps, Hoffman, and Dahlbaum. I remember when it was eventually presented at the Society of Nuclear Medicine. It was a strange thing. As much as we all take for granted, of course you'd image the whole body. Stitching together a 3D tomographic volume in multiple bed positions was not done. You either focused on the brain, you focused on the heart. Bone scanning was planar imaging. It was actually a big leap to produce what are these first set of images. Eventually, this, with the help of things that Ed Coleman was doing, who we heard about at Duke, and others at WashU, University of Pennsylvania, Hopkins, Sloan Kettering, gave birth to PET whole-body oncology applications. In all these efforts, the last person who shaped Mike was Senator Stevens. I met Senator Stevens multiple times when he would come through UCLA. Norton Simon introduced Mike to Senator Stevens in the early 80s. And Senator Stevens, again, was drawn in by Mike, just as Norton Simon was, and really went to bat for the molecular imaging community. PET imaging with FDG as the probe would never really have been approved without congressional intervention. I spent years in the lab running a decision lab modeling patient management and how we can save based on cost and effectiveness. But all those mathematical models alone and decision management would not have done anything if it wasn't for this relationship with Senator Stevens and his championing at the congressional level and then with Medicare, the approval for this tracer. Because without the approval, nothing goes forward. Same problems we continue to have now in the molecular imaging community. Even if we had a great optical imaging probe or a great photoacoustic probe, and even if we started to show initial good clinical trial results, the process of getting that approved by now CMS is quite difficult, but one in which we've learned a lot by going through it with PET. And this relationship is to be credited in large part for that. Senator Stevens passed away a while ago now. Mike also believed very early on that the animal model for biology would be the small animal model, the mouse. And whereas the imaging community was very focused on imaging pigs, dogs, obviously humans, no one had said, let's really tackle the mouse imaging arena. As straightforward as that is now, there weren't at that time many, many different modalities. Optical imaging was starting to think about mice. PET was starting to say, well, maybe we should be looking at rodent models because it will let us do and marry to what cell molecular biologists are doing for understanding biology. And through the great work of Simon Cherry, Ariane Hatsunao, and others, the micropet was born and then eventually commercialized to Siemens. And now, more recently, even more simplifications in Mike's drive to have simpler and simpler instruments that are easier, one-turnkey solutions continue to drive new tools that are desktop, such as the one Sophie here has manufactured and commercialized. The department at UCLA was phenomenal and is phenomenal. It's been 10 years since I left UCLA, but I can tell you, for the younger people in the audience, it's not about the papers you actually publish while you're in an institution. It's not about all the excitement even in coming to these meetings. It's really about the culture of the department. How well you interact with others, what you do to foster and help each other. It's a small community. You're all going to come into contact with each other for decades yet to come. And UCLA, just like I think several of the other large universities that were pursuing molecular imaging, had a very special culture, a culture that Mike drove. It was one of the few, if not only, places where imaging sat in a molecular pharmacology department. It makes sense. If you're doing drug development, there's a lot of parallels to developing imaging probes. Yet why aren't imaging centers within a pharmacology department? Well, at UCLA, through a lot of hard effort on Mike's part, it was within a pharmacology department. Totally revolutionized how one thought about the imaging probe development process. Mike is, of course, chair of this department, the Molecular and Medical Pharmacology Department. It's the only department of its type that I know of. It runs the clinical nuclear medicine service through Dr. Johannes Chernin, who's seated up here. It is an example of really putting molecular imaging at the forefront and bridging it to clinical translation. It directly connects the basic science to the clinical enterprise. Mike also, with his traditional Irish background, opened a pub in the department. This was highly controversial in a university that is not quite sure what you should be doing about drinking on campus, let alone putting a pub. This was run by the students. It's had its ups and downs, but you can still always get a drink there if you really try. The department and its culture was truly a unique experience. Many of the people that are in this audience have gone through UCLA, and I'll come back to that, and you know how it shaped your thinking for the decades to come. Mike went on to form other linkages between scientists. Shown here is Lee Hood, the developer of the DNA synthesizer, who was at Caltech, then the Bill Gates professor in Seattle. Lee Hood has always had a huge impact on Mike. Jim Heath, who was at UCLA, worked in chemistry at Rice to develop buckyballs, and now is at Caltech. And then, of course, others like Terry Douglas and Ron Nutt that Mike worked with to found CTI Molecular Imaging. All of them continue to explore new innovative technologies and new directions, merging in vitro diagnostics with in vivo diagnostics, merging all kinds of exciting new ways to bring things together. It is really a place set up for moving small molecules, peptides, engineered fragments, nanoparticles from basic science concept to cell culture, to a small animal environment, and then to the clinical environment. Something that we now all also strive to do around the world. Mike is very proud of his son Patrick, who just came up, more than he can probably always tell Patrick directly. I remember when Patrick was a student in my own laboratory. He is now a young entrepreneur, spinning out the next generation of PET technologies. If you look at your badge, I think it says Sophie Biosciences on your badge strap. This is a young, innovative company that's developing yet more simplified ways to develop new technologies for both synthesis of tracers and then execution of small animal imaging. Many, many people have come through UCLA, many that are here today. Adrian Lemertsma, who's here now, was at UCLA working on tracer kinetic modeling in those days. I remember working with him as a student. Osman Ratib, the individual who wrote Osirix and is now pioneering tandem MR PET in Geneva, came through and lived for quite some time at UCLA. Marcus Schweiger, who worked on cardiovascular PET in those days, working with Heinz Schelbert, Mike Phelps, just many, many people, and a very special culture of people that cared about what they did, driven by a leader who was extremely passionate and relentless and focused about one technology, one area, and that's PET. This is a sign in the UCLA Pharmacology corridor. It always made me nervous when I went by because as a student, I never quite was sure that I had a good idea. Still wonder. And it's still up. And it's a typical Mike type event. He will do something that challenges your thinking. This is a great inspiration because it really says that the place is special, that you really must have a good idea to be there, and that you will, in fact, succeed with the support and mentorship of people around you when you're there. I will end in the last couple slides by showing you that Mike, probably the first and last time you'll ever see him wearing an Irish kilt. This is actually when he was a graduate student. And this is a favorite photo that I've seen Mike show now and then. And finally, I leave you with these words. All the faculty, students, and staff of the UCLA Department of Molecular and Medical Pharmacology, Ahmanson Translational Imaging Division, and the Crump Institute for Microimaging hope you benefit from the WMIC meeting and that you enjoy the wonderful people of Ireland. Please accept my deepest appreciation and gratitude for being selected to receive the WMIC Gold Medal Award, Mike Phelps. Thank you very much.